YouTubies. I'm sorry it took me 4 months to update this or to make a new video, but I want to continue talking about polycystic ovarian syndrome. There's also polycystic ovarian disease, and then there is endometriosis. Now, with polycystic ovarian syndrome or polycystic ovarian disease, it usually comes with a whole host of different things. You get facial hair, you could have prolonged periods, or complete absent periods for a year to 2 years without help. You know, that's not healthy. So get yourself checked out. Really smart. When it comes to other symptoms, acne. You probably can't see it right now, but I have like acne issues right now. You get facial hair too. That's because your testosterone levels are a little bit higher. Not to scare anybody too much, but it's a thing. It's a hormonal thing. It's also an endocrine system disorder. And it hurts. Now, some people with polycystic ovarian syndrome or disease can actually get cysts in other parts of their reproductive system, whether it's their uterus or in your fallopian tubes, which could cause a block, which can also be painful, which is not fun at all, trust me. Excuse me, sorry. With endometriosis, that is uterine tissue that grows outside of the uterus. It's also scar tissue, and that grows just wherever. And with that, you get painful, I kid you not, painful bowel movements. It doesn't happen all the time, but it does happen. You can get inconsistent bowel movements too with endometriosis. Trust me, been there, done that. Got the t-shirt. It happens to me a lot. It can cause zero pain, or it can cause all the pain on the planet. There is 4 stages of endometriosis. There is stage 1, where there's not much in the way of scar tissue or uterine tissue growing everywhere. The second one is like, it's just like medium, no, it's like low, medium, and stuff like that, right? It could cause no pain, or it can cause all the pain in the world. Now, with endometriosis, it causes intense periods that are either really heavy and are really, really painful. And me personally, I have both of those conditions, and it puts me into a whole lot of pain all the time. I feel like dying. Some days. Another thing that I think is important to realize with these 2 conditions, especially with couples, it takes patience and understanding um, to understand what the heck is going on with your partner, because it's out of their control, 100%. Also, with both of those conditions, you can get nausea, you can get like infections easier, and with both of them, they're like, you can have insulin resistant polycystic ovarian disease or polycystic ovarian syndrome or disease. It's definitely not as fun as you'd like to think. Like, I live with both, which isn't cool. Which means that you'll have a harder time getting pregnant if you want to have a baby. There's a few other things that get in the way. It's not as... like, with both of those, you can have mental health issues. Some of us don't really have any mental health issues that coincide with both of these conditions. And if that's the case, you're a very lucky person, because I have anxiety. And I was diagnosed around the same time I was diagnosed with endo and PCOS. So, unfortunately. Another thing with both of these conditions, you're going to find that you're lacking in energy. You'll gain weight so fast, and then it'll take you forever to lose the weight, which, trust me, is not fun. Those of us who have both conditions, it is easier for us to miscarry, not to scare everybody. Just how it goes. I'm on medication to try to help with these two conditions, or in this case, 3 conditions. I'm on metformin to help with the insulin resistance part of the PCOS. And I'm not on anything currently for my endo, because they did try to put me on something, but that made me super sick, and it wasn't fun. To help regulate your hormones, you can also go on birth control to regulate the hormones, which is good and all. It just kind of can cause other issues as well. So you want to consult a doctor anytime you want to do a treatment for anything that is related to your reproductive system. Some people say that going to an endocrinologist has helped. I'm going to talk to my doctor the next time I see him to ask him about seeing an endocrinologist to see if there's anything else I can be doing to help what's going on with me. But yes, that both of these conditions are because your hormones are all... they have decided to go, instead of being like, okay, we're going to do this, we're going to do this instead. Which, they're inconsistent. Like, it takes blood work, a lot of blood work, trust me, and ultrasounds. Some of us get diagnosed by exploratory laparoscopic surgery done by a gynecologist. That's how I was for sure diagnosed, was when I went for my first surgery in 2012 by my gynecologist at the time. And he told me that I had both conditions. And I had both conditions pretty bad. So there's that. Also, with both conditions, you can get something called PID, which is persistent pelvic inflammatory disease, which is it causes a lot of pain. It can be caused by getting STDs, or it's just something that happens for you, unfortunately. And yes, I am filming this on my phone because I don't have equipment, because I am new to this. But, and everything else that you do, just when you're having a bad day or there's a really bad flare, just take it easy. And try to help your partners get educated in the conditions that you have. Because another thing that can happen with both these conditions, I also, with those two conditions, I have two other conditions. I have two uteruses and two cervixes. Fun stuff right there. And I have a heart-shaped uterus that is tilted. So much fun. So if you're in the same boat as me and you have all of those conditions, you have to make sure that when you get a pap smear done, both of those, your both cervixes and uteruses get swabbed, and they find them. It is important for your reproductive health, to make sure that every 3 years you get those two things checked out to make sure that you don't get cancer in either one of them. So yeah. I'm going to try to actually get some friends to talk, because I do have other friends that do have these two conditions. Which, trust me, is not easy and not fun. I'm going to see if I can get my husband to come on here, and so we can talk how it affects our relationship. And what it's like for him on his end. Because maybe it might give you, the other person, some insight, or the other person in your relationship. Okay, I'm not alone. This is okay. This is almost normal for them. And everything else like that. So yeah. Be safe out there, because there's COVID everywhere and it sucks. So just be safe. Wear your masks, wash your hands. Be safe. Until the next video.